Number one, nobody is proposing scrapping the entire system. We're simply proposing adding more people to it and opening up more coverage to more people, thereby bringing down costs. Second of all, I'd like to say that nobody has proposed any sort of Canada or British-style universal health care at all, so I mean, the discussion is a moot point on that subject.
Meeks.
The new House health care bill that came out, this is the one that they're going to actually vote on. They put it together. It's H.R. 3962. That's 1,990 pages, about 400,000 words. The Congressional Budget Office, which is a nonpartisan group, has pegged this bill at $1.05 trillion over the first 10 years. The reason why it did not cost more is because, number one, the bill itself does not, the public option does not kick in until 2013, but all the taxes kick in next year. Okay, so they're going to actually be at a positive or a plus up until 2013. Otherwise, it would actually be more expensive.
10 seconds.
So when we're talking about paying for the bill, again, it's taxes on employers and taxes on you that are going to end up paying for this bill.
Well, I just see the government taking over quite a few things, and this is just one of them. And it bothers me that we think the government is the answer to this solution, because every time the government gets involved in something, money gets mishandled. We're creating a bureaucracy here that's going to be hard to get through. And now keep in mind, I do think there needs to be health care reform. I said that in the very beginning, and I laid out 4 little points there we're talking about. There needed to be health care reform. But when it embraces socialism and good UN policies, and to tell you the truth, if you would go online and print out UN Agenda 21, you would see exactly what I'm talking about. We'll be good global citizens with world government.
10 seconds. Just not 10 seconds. You
I'm a political science major, so I know what socialism is. Socialism is a social system that runs all industries. This does not amount to socialism. It is market-driven. It does not run a single private vendor out of business. If you're going to use terms, it would help that we would use terms correctly. Secondly, it would also be helpful if we would understand that the idea of taxing something is not abhorrent in this country. The question is, are we getting something of value for the tax dollar? And so I don't think it's a bad thing to pay taxes or to give money tax. I pay taxes for the government to run the military, and I don't get a chance to decide if we war they fight. But I want the government to have a military. Now, I don't think that just because every penny in every bill is not going everywhere, that it needs to go for cost effectiveness. We do nothing. Or we only do as little as we can. That is not a prescription for good government. That's a prescription for inadequate government, for weak government.
We'll come to Mr. Noonan, and then we're going to shift gears. Mr. Noonan.
Real quick, I'd like single people in this room to raise your hand if you're making $500,000 a year or more. All right, for married couples, are you making $1 million or more? You won't be taxed. Also, when they're talking about businesses being taxed, 98.8% of small businesses will not be taxed on this because the threshold amount for their payroll is higher than they pay out right now. So this tax argument is actually pretty weak.
Okay, ma'am, here's what we're going to do. I've tried to sanitize a number of the questions. I've also gone through some of these this is a church.
I'm cussing people out.
I tried to sanitize some. Sanitize is nice when you have to inform the issue. Back into some more questions. And I've gone through some of the questions, and when they've been answered by the panel, when the issue's been addressed, then I've asked you, so you might not hear your exact question being answered because some of you are turning the same questions and without, of course, knowing what other people thought. Here is one, and I'm not sure if this was directed to Dr. Nash. It indicates that, but it goes to the whole panel. I'll start with you, Dr. Nash. It says it has your name at the top. do you feel that tort reform should be a part of healthcare reform? And the last part was, why has no one promoted this avenue? That might be outside of the MD.
Yeah, that's slightly out of my purview a little bit, so I will ask my legal colleagues to help me with this, because this is my, I've done some study of this issue, because in previous years we did have a lot more debate around tort reform. But for me, as a healthcare provider, and looking at the issues and looking at the research, I have determined that tort reform didn't necessarily correlate to lower malpractice insurance for me as a healthcare provider. Now, it has larger implications for other larger companies, and I think that was where it was intended. So I have to ask my legal colleagues to help me with that.
I love this tort reform argument because it's another bogus. It's another, and one of the things about being educated is you love when folks make bogus arguments because it's always shoot them down. Here's the issue. Lawyers do not make people sick. Judges do not make people sick. Courthouse do not make people sick. People don't go to the courthouse to get well. So why are we putting tort reform, which is about lawyers and judges, in a piece of legislation dealing with health care insurance reform? Why? Because people want to limit access to the courts for people who are hurt. That's what tort reform is about. It's about limiting access to the courts for people who get hurt. Now, if you get hurt because of a bad appliance or a bad product, why should the health care insurance reform have a thing to do with that unless you don't like certain people getting to the courthouse? Or you don't want to get people to lawyers to get to the courthouse. Let me remind you that tort reform is a big, big, big boogeyman that people are using to scare folks. You know who's really scared? Folks are scared that they don't get to a court. Because if they don't get to a court, they know that if they mess up, they'll get sued. I am glad to be a lawyer because I want to be able to sue.
And that comes from a person who spent a great part of his time early on defending insurance companies. We'll come to Meeks, Burlsworth, Porto, and then Simon and Abrams.
What is going to do health insurance a lot? Doctors pay anywhere from $80,000 to $120,000 a year in some places because of the possibility of them getting sued. They pay $80,000 to $120,000 in medical malpractice insurance, okay? Just in insurance. That's not their own wage, it's not paying their employees or paying their staff or anything like that. They have to cover $80,000 to $120,000 just to pay for medical malpractice insurance, okay? Now, what I'm not saying is, I'm not saying that if somebody cannot go and, sue because of something that a doctor may have done wrong. Okay, because it happens, I want to make sure that they get taken care of. But what we have to be looking at is, is it worth $2 million? Is the mistake worth $10 million? Because these are some of the judgments that these people are getting. For even a little bit, even for a little bit. And so I think that's what we have to do, is we have to find a balance between making sure the person is taken care of if the doctor is making a mistake, but it doesn't need to be over the top to where their medical malpractice insurance is $80,000 to $120,000 a year, which does raise the cost of your visit to the doctor.
Thank you.